Okay, so I am using Frank, which is my drawing right here, for my physical assessment that I'm going to be doing because all my roommates decided to skip town tonight. And we don't have any dolls in our house or stuffed animals or anything else. So I'm stuck with Frank. So I'm going to go over the physical assessment, the things that I'm going to do. So I'm also not looking at a paper or anything. This is just off my head. So tablet's off and it's off to the side. So I'm going to try to remember everything that's important. Well, everything is important in a physical assessment and hope that my phone doesn't fall off. So the first thing that I would do is I would perform hand hygiene while I walked into the room. So put on some hand sanitizer, probably put my gloves. I'm going to put my gloves on. I would ask the patient if it was all right if my professor would watch me perform a physical assessment on them. And if they say yes, then we're going to start out by talking to them to kind of listen to see if they are responding to, if they're hearing okay. So if they're responding to questions and communicating that way. So I'm going to ask them their name, their date of birth, and I can ask them how tall they are, how much they weigh, which I'd probably just pull that from the records that they have or measure them there if I have the equipment. So with that information, I'll ask them why they were admitted, and they would tell me why they decided to come to the hospital. Could it be a broken leg, broken finger? They could have been just had a surgery. So instead of serving what their primary diagnosis is, and then I talk about their secondary. So is there any kind of pain related, if there's anything that we can kind of do at that moment, or if there's something else that there's an issue. So if they had surgery, they've been in bed for a couple days, and they have an ulcer, that'd be kind of more of a secondary piece. And ask them about their pain. If they said that their pain was in their abdomen, I would roll up their shirt. I would look where their pain is, and ask them what makes it feel better, what makes it feel worse, when did it start, out of 0 to 10, what would you rate your pain? So I would take that information, write that down. I would also ask them if they have any allergies, and if they did, what the reaction is. So then we can make sure that that is in the system and that they aren't getting that. And if they haven't already been, if it's something new that's not in the system yet, we want to make sure that's in there for them. After that information, we're going to ask them, we're going to go with their orientation. So I'm going to ask them, we've already asked them who they are, so we'll probably ask them again. So say your name, where are you, why are you here, and about what time it is, to kind of just see if they're already in awake and oriented times 4, which Frank here is not awake and oriented, so he is 0. He's asleep, or non-existent. So after going over that, we're going to start in kind of inspecting, like seeing how they're reacting. Are they being sluggish? Are they not? Like just kind of to see where that cognitive is by just communicating. Now I'm going to go into my vital signs. So I'm going to check their blood pressure with a blood pressure cuff, and I can ask them if they have a preferred space, or if they've had ask them about their medical history to see if there's anything that's going to prevent me from doing that. So if they had a bunch of lymph nodes replaced on one side, if they had breast cancer and had a breast removed, we wouldn't want to touch that side. So we're going to use the other side. And while we're doing that, we'll check for the IV sites to see if Frank here has an IV site, and we'll look at that to see if it's if he's having any reaction to it, if it's a new or if it's old one, see if the dressing's clean. So we'll check over his IV. If it's clean, that's great. And we'll also ask him if he has any other tubes or anything else sticking out of his body. So we'll go from that. We're going to check his blood pressure. So use that with a blood pressure cuff, and we're going to listen to that with the stethoscope. We're going to listen to his blood pressure. I would probably check it once or twice just to double check that it was correct. Within that, I'm going to be checking their pulse. So I'll be checking the pulse on both the wrists to see if it's bilateral and equal. If it's not, I'm going to write that down. I'm going to also check that on the feet. I'm going to check the temperature in the feet. I'm going to check that pulse to see if it's the same, if it's strong and regular. And then also I will check their pulse and time it for 30 seconds. And if it's irregular, I will time it for a full minute and write down what their heart rate was. So now that we've done that, we're going to listen to their heart and lung sounds. So we're going to listen up on the higher part of their lungs up top. We're going to come down just a little bit. We can also kind of come down more on the sides to see if we can hear anything down there. And then we'll ask them to sit up, and we'll do the same thing on their back. So we're going to listen to there, have them take deep breaths, and we're going to have them maybe cough to see and make sure that the air is equal coming in and out of the lungs. What else are we going to do? So while we're doing that, since we already have the stethoscope on, we're going to auscultate his heart sounds. So we're going to start with, there's going to be 5 spots. There's going to be aortic, pulmonic, so it's pulmonary, mitral, mitral and mitral? I'm going to look that one up. I can't remember what the 4th and 5th one are. The herbs and the tricuspid. So it's going to start in the second intercostal space, and we're going to work our way down, and then to get to the mitral space, where we're going to also check his pulse. We'll go down from his sphenoid process and kind of come straight across. We'll find it there, come to the side. So it's going to kind of come down and around, and we're going to listen to that one, and we're going to be able to take a pulse from there as well. And we're going to write down everything that we've done. We're going to write down what arm we took his blood pressure, where we took his pulse. We're going to write that all down. And so we're going to move from there, since we still have the stethoscope on, and we're going to listen to his bowel sounds. So first we're going to ask if it's all right if we remove the top of his shirt, or the bottom of his shirt. So we're going to move that just a little bit, and we're going to inspect the abdomen, and we're going to feel it in the 4 quadrants and see if there's any pain, see if it's soft, see if it's warm, because temperature is a big thing. Oh yeah, temperature is also a vital sign, so we want to check their temperature as well. So, and then we're going to listen for bowel sounds in those 4 months and see if they're hyperactive, hypoactive, non-existent. Depending on what surgery they had, it could be either or it could just be normal. Or normal is a bad word, so we're not going to say it's normal. So that's going to be checking that there. And like I said, we're going to feel each of them to see if they're soft. If there's a hard space, that's a warning sign, so we're going to check that out and make sure that everything's okay. If he had surgery there, it could be a bleed. If he has a wound, we'll want to clean it and everything there. So we'll put the shirt back down. Listen to that. We'll talk to him, since we're kind of in the bowel region, and ask him about his ins and outs. When was the last time he ate? About how much it was. When was the last time he drank? How much that was. Not necessarily how much that was, but about when it was. And we're going to ask him about defecation. So we're going to ask him what did his stool and his urine smell like? What did it look like? Was it difficult? Was it easy? Is he having frequent trips to the bathroom? Kind of get more information about that from there. So now we've kind of checked out his whole torso. We've kind of looked it over. I'm going to go back to the top of his head, and I'm going to kind of just feel his scalp to make sure that there's no irregulars there. See if he's kind of look for pain, anything kind of sticking out. We're going to see look at his ears to see if they're equal. and the location on their head, kind of where they're at. We're going to look at their eyes to see, I mean, he could have came in and it could have been bloodshot. We're going to look at his eyes. We're going to have him, we're going to look at his tongue, we're going to look at his lips, and we want to make sure that his lips are nice and pink and the mucus both in his lips and his lips are nice and moist. We're going to also check his pupils by taking a light and seeing if they're reactive, and then we're going to react to the light, and then we're going to also have them follow our fingers and to see if every axis of both of his eyes are functioning properly. And so if everything's great, if his eyes are pearl, that means their pupils are round, regular, and reactive to light. Equal, round, regular, and reactive to light for Perla. I'm going to check that out. We're going to feel down underneath his chin. So we're going to feel down underneath his chin, on his neck, kind of feel the lymph nodes and see if there's anything abnormal. We'll see if his trachea is in line, which is what we want. Kind of really feel around that neck part. See, not necessarily see if there's any tension, but kind of like look for lumps inside of that. And then we'll go down to his arms, feel if there's any pain with anything, if there's any skin damage. We're going to see if there's been any ulcers, if he's been in bed for a while, and that's what we're going to also look on his back and on the back of his head, look over that, go down the arms, work our way down the arms, and kind of feel around to see what they're like. And when we get to the hands, we're going to have them squeeze our fingers. And we want to have them squeeze our fingers to see if the strength is strong, weak, if it's bilateral, if it's not lateral. If he had a stroke, he may only be able to squeeze one hand versus the other, which wouldn't be great. So we want to also check that. And we're going to also check that capillary refill. So we can see how fast it's filling into his finger. We can also pinch it, and we're going to see if his skin is tenting or if it's not tenting, and that if it was tenting, it'd be showing that he'd be severely dehydrated, which is a bad thing, which means we probably want to be getting fluids into him. And while we're working through this, we can get more information at him, because we can be doing two things at once if we're good at it. Ask him about his family life. Is he living alone? Is he living as a care home? Maybe find out some educational information, kind of see what he's up to, what he does for work, how he's coping with different stressors that he is potentially dealing with, especially since Frank might have just had a surgery. That could be creating stressors, how he's coping with it, and we can maybe give him a few pointers of how to cope with that. So we felt the arms there. We can kind of work our way, kind of feeling the torso as well. Feel the ribs, make sure, see if he has any pain there, breathing in and out, which we kind of already gone through that. We're going to work our way down, check his legs, kind of feel around the legs, see if there's any pain, inspect them, see if there's any bruising, scarring, dry skin. You can kind of look at his buttocks and see if there's been any issues there. We're going to look at his penile area and see how he's coping there. He may also, since I'm in there with an instructor and I'm a student, he may not feel comfortable with showing those parts. I can understand that. So we can maybe not necessarily want to skip over those. And then in full nursing world, we're not going to skip over those. We want to look at everything, and we want to see him see skin everywhere, because medicine happens at skin level, or that's where it starts to happen. So work our way down his legs, inspecting those like I was saying, seeing if there's a temperature, looking at color of the skin, if it's blotchy, different things like that. If he has moles, that could be something to write down. If you see any irregular mole, be like, hey, maybe we want to check this out in the future. We're going to work our way down to his feet, take off his socks. We're going to feel them, make sure that they're warm. We're going to have him push and pull on our hands. So we're going to hold above his feet, and we're going to have him dorsiflex, and then we'll put our hands below it, and we're going to plantar flex, and we're going to do that to see, just like the arms, if the strength is equal or if it's not. Like with the stroke patient, he may not be able to do that. I was on a unit, and they some of the patients weren't able to use their feet, so we are constantly checking their feet to see if they were starting to get filling back in their legs. So now we've kind of gone head to toe, kind of checked everything. What else do we want to do? let's talk about allergies. We also need to ask about their medication history, see what they're taking, what they're not taking, if they have diabetes or anything like that. If it's a woman, you'll most likely ask when their last period was, how that was, like was it regular for them. If it's an older woman, you're asking that question just because they potentially could be in menopause, or they're like, hey, I haven't had it for 4 months. They could be in their early stages of menopause. So that's some other questions that we want to ask there. While we're doing this, we're also going to be using other senses. So their smell, if they have poor hygiene, it's something that we can maybe bring up or encourage them, because hygiene is an important part of staying healthy. So after that, we're going to ask the patient if there's anything he needs a blanket. We'll hand him his call light. Listen to any questions or concerns that he has at the moment. If he did need some dressing changes, we could potentially do that then, and just make sure that we're documenting everything that we do. So we've handed him a call light. We'll perform hand hygiene, or doff the gloves, perform hand hygiene, and make sure that they're in a comfortable state. And at the beginning, I don't remember if I said it, but we're going to also provide privacy for the patient to make sure that they are comfortable with us in there. We're not going to leave the door open, and if the door has to stay open, we're going to close the curtain, so then it could just be the patient and the provider. So that's it. I wish I would have been able to do it on an actual person, but I got to do with what I got. So Frank was my main guy today. Thanks.